Hello, guys. Good evening. Good evening, BU. I missed you in the fundus session. But anyway, you can watch it again. All right. So here we are going to discuss the images that we did over the last 1 week. And people are wondering, some of you had actually texted me, ma'am, where are you doing these images? Hey, I'm posting no on Instagram. So those images are what we are going to discuss today every Sunday 6 p.m. Thankfully, touch wood, we discuss our fundus image at 5 p.m. and the images at 6 p.m. So today we've got some interesting images which we had posted over the last 1 week. So shall we start? So this one. So this is the right eye. Now, why right eye? Because this is your medial canthus. You can see the caruncle and you can see the lateral portion of the lid drooping. Yeah. So you have an S-shaped eyelid. There is a swelling here. The inflammatory, reactionary inflammation and the edema is pulling the lid down here. Yeah. So what is the most likely cause? What is that structure which is present here? What is that structure which is present here? Good evening, Harish. Oh, Harish, nice. मेरा अपना वाला हरीश है ना? ImeNian. All right. Good evening, beta. How is your internship going? I assume you're still in internship. Yes, so we have our lacrimal gland here. Yes, so that lacrimal gland, when it gets inflamed, you get a reactionary swelling causing a mechanical ptosis affecting the lateral part of the eyelid, pulling it down. Yes, so inflammation of the lacrimal gland. Very good, BU. Very good. So inflammation of the lacrimal gland is called Dacryoadenitis. Okay, inflammation of the lacrimal gland is called Dacryoadenitis. Now, where is the lacrimal gland present? Is it present in the roof or in the medial wall? Roof is where your lacrimal gland is present. Okay, so with respect to the frontal bone. Your lacrimal sac, which is part of your lacrimal drainage system, that is present in the medial wall. Is that clear? So if I were to have a lacrimal sac swelling, I would have a swelling in the medial canthal region, and that is called dacryocystitis. This one is called dacryoadenitis. So this image is dacryoadenitis, which is a painful swelling. Maybe, but for a stye, okay, you could call it a stye if we see a pus point. There is one white dot there, but that is like more like something like a dandruff sitting there. Yes, even a stye can cause, when you have a stye in the lateral part of the eyelid, very good BU. Yes, it also, a stye in that part, or sometimes even a chalazion, okay, a hordeolum internum, especially hordeolum internum can cause. Now, if you consider this as a pus point, okay, if you think this is a pus point at the base of eyelash, so tiny, probably it is hordeolum externum. But anyway, in the options that I had given, there was no hordeolum externum. But actually, this is a case of dacryoadenitis. This is a recorded case of dacryoadenitis, not hordeolum externum. Okay. Chalazion. See, sometimes when you have a chalazion towards the lid margin, it can be like this. But chalazion will be painless. Yes. Chalazion will be more rounded, as you are rightly saying. But yes, if it is more towards the lid margin, usually it is away from the lid margin, but when it's more closer to the orifice, yes, then it can look like this. Okay, yeah, various presentations, but they'll definitely give you a typical image. Okay, a classical textbook image is what they'll give you. So don't worry about that. Now, next one is an instrument. Identify the instrument seen in the image. What is this instrument that you're seeing? In fact, you're seeing a lot of things here. So there's actually a little kid performing using that instrument. So that bacha's head you can see. Okay, a little bit of the forehead you can see. Can you see that? His block of hair is there and you can see his forehead. So what is this instrument? Do you need any options for this? Oh, BU, very good. You did 𝐾𝐿 and INC, very good. All right. So what is this? So you can see that little bacha sitting there, that little kid. Yes. So there are two arms to this instrument. You remember we used to slide in the slides into the two arms of the instrument. What is this instrument, guys? What is this instrument? Do you need options? Because I don't remember the options that I actually posted in the question. So, what is this instrument? Hello? What is this instrument? You must have seen it in your ophthalm department, even if it's, kind of redundant, they're not using it. You must have seen this instrument. So this instrument is Synoptophore. Okay. So that is Synoptophore, which we can use to measure the angle of squint, but that's a subjective angle because the patient cooperates. The patient has to, move the arms and then we measure. So that's a subjective measurement of squint. You can measure angle kappa and you can also look for the grades of binocular single vision. Okay. So this is Synoptophore. Everyone clear with this? Yes, Synoptophore in action. Yes. All right. Now next is an interesting image. What is the investigation being done? I've marked all the structures. So it's very easy for you to guess this. So this is the appearance you'll get on gonioscopy. So when you're looking at the angle, so you're seeing the angle between the iris and the cornea. Yes, so that is the angle. You're seeing the angle structures, the posterior most, the iris, then you get the ciliary body band, then that whitish area line is a scleral spur, then that pigmented line, that is your trabecular meshwork. To be very specific, that is your posterior trabecular meshwork, and the anterior most Schwalbe's line. Yes, so there is a mnemonic for this angle structures. Yes, I can't see this stupid line, or you can say I can see Schwalbe's line. I can see till Schwalbe line, or better, I can't see this stupid line, because that is how all residents feel when we first do gonioscopy. Okay, you don't know where to see, you don't know what to see, whatever you see, you don't know what exactly you're seeing. So I can't see this stupid line. That's nice, no? When you have a stupid there, it's interesting. I is your iris, can't is your ciliary body band, C, SEE, scleral spur, S, scleral spur. This trabecular meshwork, stupid line is your Schwalbe's line. Schwalbe's line is not a stupid line, it's a landmark. But anyway, that's an interesting mnemonic. So what is that mnemonic for you to remember the angle structures from posterior to anterior? Iris root, ciliary body band, scleral spur, trabecular meshwork, and Schwalbe's line. Yeah. And when do you call an angle open? Overall. Okay, I'm not going into the grading. If you're able to see the scleral spur, if you're able to see CS, okay, triple S, SEE, scleral spur, C, scleral spur. Remember, triple S, SEE, I'm able to see the scleral spur, angle is open. Is that clear? So what's that mnemonic for you for gonioscopy? So on gonioscopy, you can visualize the angle structures, which are from posterior to anterior. I can't see this stupid line, or I can see this stupid line. Iris, ciliary body band, scleral spur, trabecular meshwork, and Schwalbe's line. Is that clear to everyone? Imprinted in your brain. Okay. So in other words, they will not mark and ask you this is what structure. I hope not. And I pray they won't ask you something like that. But if you see some kachamucha image like this, okay, where you feel like, okay, this is something of the eye, but I can't see anything of the eye, then you're looking at the angle structures. Okay, this is very, very easy. Often asked question, IBQ. This is your limbal dermoid. So you can see that limbal dermoid. Most common location, inferotemporal quadrant. So that means this is the right eye. Inferotemporal limbus is where you see the limbal dermoid. Okay. So that is a limbal dermoid. Lipodermoid, I'll teach you on another day. So put this in your brain box, limbal dermoid. It will appear like pinkish, yellowish, and mostly you will have hair sticking out. So here also you have some hair sticking out. If you do histopathology, you can find sebaceous glands, hair follicles. You can even sometimes find cartilage and a little bit of osseous transformation. Okay, so that is limbal dermoid. Which syndrome you get limbal dermoid? Which syndrome do you get limbal dermoid, bache? Which syndrome? You strike gold if you know the syndrome. Yes, you strike gold if you know the syndrome. If you don't know the syndrome, haar jaoge. What is that syndrome? Golden hair syndrome. Very good, BU. Golden hair syndrome. Okay, golden hair syndrome is where you see limbal dermoid. So we are done with the 4 images. Some were just MCQs. So we are done with images decoded session. So I hope whatever we've been discussing is familiar and you're confident with those images, because opthal is completely image based. Okay, see, diagnosis is mostly, is not mostly 100% of what you see. I have to see to diagnose my patients, no? So image is very, very, very important. Yanda VKH ni nanicha? Why you thought VKH? VKH la, you don't have such findings, no? See, VKH is a granulomatous panuveitis. Anterior segment, at the most, you'll see some redness. You might see mutton fat KPs, iris nodules. Not this one sitting on the limbus. Okay, so limbal dermoid. Remember, limbal dermoid, golden question. Okay, golden question. Okay, you strike gold, golden hair syndrome. And if you knew Hindi, you will know har means to get defeated. Har jaoge. You will get defeated if you don't know the simple question. Okay, so golden hair syndrome. Yes, very good. Very good, BU. I'm so happy. All right. So guys, I will see you on Tuesday. So Tuesday 11, we're going to discuss neuro-opthal questions. So where do we get those neuro-opthal questions? Because tomorrow 6 p.m. we've got the neuro-opthal quiz on my Telegram academic group. And the Republic Day sale is live. So please make use of it. Tomorrow is Republic Day. Happy Republic Day to everyone, because tomorrow I will not be seeing you. Okay, so happy Republic Day to everyone. God bless you all. Enjoy the holiday. Make it more useful for your studies. Okay, so that is all I can tell you. I don't want to advise. So make a plan. Thoda sa relax also, but make a plan. Okay, and make it productive and useful. That is very, very important. And your NEET PG dates have been announced. So do make a plan. Yes, and study well. I will see you on Tuesday. And yes, tomorrow we are starting with a new test and discussion batch. We do have a 20% discount for people who are joining in early. So you can avail that also if you're taking it early. I'm keeping the batch size limited so that, I can follow up with you. We're not taking huge numbers. Every batch we are having a smaller size, so that I can mentor you personally. I can follow up whether you're doing the test, not doing the tests, how you're performing. So I can follow up. So join the batches and make use of that 20% discount as well. All right. So the test and discussion happens on the EyeMentor Dr. Rajarathna app. That is not the Telegram quiz. Telegram quiz, just 10 questions a day. So the aim of this test and discussion is to prepare you for INI-CET, May INI-CET as of now, then your NEET PG 2026 and the PDCAT. So we will be doing 1,000 questions for INI-CET and 2,000 questions for NEET PG, and yes, 1,000 questions for around 1,000 questions for PDCAT as well, so that you are very well equipped with ophthalmology, very confident with ophthalmology by the time you go for the exams. All right, guys. Ciao. Have a good Sunday evening.